Welcome back to the NRCME exam walkthrough. We are on page 3 of the audio companion and the walkthrough. We're talking about physical demands. There's grip strength, upper and lower body strength and range of motion, lateral cervical mobility, balance, climbing, reach and prehension, and touch sensation. Here's a couple examples to discuss to help clarify. A patient without their fourth and fifth fingers, they can be clear. They can be certified. If their grip strength is normal, there's no specific test for grip strength. Now, how about a patient who's unable to flex their knees beyond 90 degrees or to climb? They will be disqualified because they cannot climb or flex their knees. If the driver has hypersensitivity pneumonitis, you need to advise the patient to avoid transporting the causative agent. I think that makes sense. Avoid transporting the causative agent if they have hypersensitivity pneumonitis. Okay, now if the driver has taken sedating medications, they need to avoid driving less than 12 hours after taking those medications. 70% of excessive daytime sleepiness, or EDS, cases are from narcolepsy or obstructive sleep apnea, OSA. The patient is nodding off the history of sleep at the wheel. You need to disqualify and refer to their PCP for a sleep study. If the patient or driver with COPD is on inhalers, green sputum, mild dyspnea on exertion, or you have another driver with asthma, upper respiratory infection times 2 week, increased inhaler use, mild wheezing, you need to do PFTs. So symptomatic with these histories, asthma or COPD, consider doing a PFT, okay? Now, there's a magic number with breathing tests. So when we're talking about respiratory testing, there's a magic number at 65. So remember this. For the test and for clinical practice, 65% is what you're looking for. 65 or better. With PFTs, okay, you're looking FEV1, forced expiratory volume in 1 second, needs to be greater than 65%. Now, if it's less than 65% for the FEV1, you're going to order ABGs, and then the PaO2 must be greater than 65%. If the PaO2 is less than 65%, you need to disqualify the driver at that point, and they can look into getting those numbers improved with a pulmonologist. Consider disqualifying if these respiratory conditions or findings. There's bronchiectasis with hemoptysis, COPD with cough syrup, or asthma with frequent hospitalizations. Now, a second spontaneous pneumothorax in the same side without surgical intervention requires surgical intervention or surgical correction before they can be certified. For more information about the other products we provide regarding the DOT exam, in other words, the NRCME, please go to our website and purchase our products there. Thank you for your support.